in some areas where you've got a lot of specialists, you might operate a pretty narrow scope of what family practice can entail. And when you're in rural medicine, you don't have that access, and so you're practicing, to the fullest extent of your license.
I like rural medicine. I came from a town of 13,000, but I wanted some more opportunities for my family. But I get lost in a big city, and this, to me, is kind of the perfect balance of that.
Yeah, I grew up in the Bay Area. Actually, did my graduate school in the Bay Area as well, and came up here for a preceptorship rotation while I was still in school. And it ended up turning into a job. Felt like MCHC was always really supportive of me, and I knew I wanted to work for an FQHC that had a really strong mission and was willing to foster a new grad, and been here for 8 years ever since, and it's been amazing.
With the doctor shortage we have in the country right now, people are used to doctors cycling in and out, and they find that very disturbing. And I find it disturbing too. I like being involved in my patient's life. It matters to me that I matter to them. I've been here 9.5 years now and built some really good, strong relationships. Really feel like I've made some positive impact on people's health.
I think there's several things about working here that are attractive to mental health therapists. The first is that you can see your patient, do your note, and go home. There's not any after hours on call or things that sometimes go along with the behavioral health profession. For us, the patient comes in, we do a brief assessment, and if we determine that they could benefit from treatment, we can start treatment right away without those delays in care.
One of the things I really like about working here is all of the providers work well together. We are there for one another, whether it's in consultation, we work in the operating room together. At any time of the day or night, we can call each other and ask for advice and ask for help, and there's never a hesitation to come and help.
The organization itself, I think, is perfectly sized. We're big enough where we can take risks, we can try some new ideas or ventures without really hurting the bottom line. But we're also small enough where I can go knock on the CEO's door and say, hey, I've got this idea, let's talk about this new concept or this new approach I want to do. It's big enough where if you want to be involved in leadership, you can have a direct impact on patient care or the direction of the clinic that we take. But we're also big enough where you don't have to. You can see patients and make your impact there. That kind of size creates a kind of a family atmosphere. I spend a lot of time with the same group of people day in and day out, and over the years it's really created pretty strong personal bonds with a lot of my coworkers, which is really rewarding. It's something that I look forward to when I come to work.
This is almost a one-stop shop as far as we have medical care, we have dental care, we have women's health, we have behavioral health, we have some specialty care like psychiatry and podiatry and chiropractic. There's just a lot of services that we offer that people are often surprised to find out that we have all that here, especially in a small rural area.
Here, when we see patients, we also share patients. So when we are at our desk looking and discussing patients, there's a lot of information that goes back and forth. So there is a lot of scope of improvement, and there's a lot of scope in discussing what we learn and going from there, We develop every single day, we grow. For providers, we look all over, including the H-1B category visa holders, as well as people who are nationals here.
When I first came to this area, the beauty of it just really struck me. The sky was so blue, and there were hills and clean air, and that kind of small town feel that I was looking for as a place to raise a family. And the more I got to know the area, the more I fell in love with it.
This education system is unique here because we do have a variety of options. My own children have been involved in 2 separate elementary schools. The Tree of Life Montessori School is a Montessori-based education. It's K through 6, and so Montessori is very unique because it really values hands-on learning and peer-directed learning with teachers as guides. 3 of my children have gone through that system. My youngest 2 were admitted into the dual Spanish immersion program at the Grace Hudson Elementary School. That's been beneficial because I've valued them learning Spanish. They're now in 1st grade together, and both of them are doing a very good job learning and making new friends at school. In the junior high, my children went into Redwood Academy, which is another charter school in our area, which has won quite a few awards for their academic achievements for their student. My son is now a high school student, and he's at Ukiah High School because he transferred there because he loves athletics and he wants to play soccer and run cross country, and those opportunities were available at Ukiah High School.
If you were really into the outdoors and you really like to spend time camping, you like to spend time off-roading, you like to spend time on the rivers, fishing, I mean, there is so much to do here.
You know, as a medical care provider, it's important to be heard because you're the one, you know, taking care of the patients directly. In a lot of organizations, sadly, nowadays in medicine, that direct communication may not be there. Like, you have to kind of go through, you know, formal steps to be heard, basically. And MCHC has always been very approachable and teamwork centered.
Burnout and mental well-being and physical well-being is a huge part in why people are leaving the field right now. So to have that balance is really, it's important.
Provider burnout is at a historic high. So I think it's vital that we make sure that people are getting out of here at the end of the day. And I'm glad to be able to live in a community where there's options for them to have some releases outside of work and to get out. There's, you know, parks and golfing and hiking and all of those things that can be, you know, just an opportunity for them to recharge. But mostly it's about providing the right environment so that people feel satisfied at work, that they feel like their work is really adding value, and they feel fulfilled and purpose-filled. And I think those things all add to our well-being and our mental state as we go through life.
I'm excited because this clinic's been going for 30 years, and I meet people every day who've been here for a significant part of that. 9 years, 13 years, 17 years. You know, in all kinds of economic conditions and pandemics and everything else, and they are here for the long haul. They are taking care of their neighbors. That you can't get everywhere.
You know, it's true. Every employee that we have is here to take care of people, to save lives. And it doesn't matter whether they're sweeping the floor or trimming the bushes outside. Those things demonstrate to the patient that walks in that we take good care of our things and we will take good care of you. So I think it's really a lot about being part of something bigger than yourself.